Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart to heart conversations about their day to day lives while sharing their expertise for improving your health and wellness.
So, welcome to the Healers Cafe. And today I have with me Anne Marie Ferguson. And she was introduced to Bowen therapy at a wedding rehearsal in 2013 on the Gold Coast in Queensland, where basically they lived for a couple of years. And I think it goes on, the whole story develops from that time on. And I think I'm going to leave you to explain sort of what happened with Bowen? Why did you get into it? What was it to you? Because, in Australia, Bowen is, Tom Bowen was born there. So some people know it, but I've talked to many Australians that still say, Bowen, what? Is that the airplane? So, and here in Canada, well, it's more and more people know it, but still not the level it should be known. So I'm really thrilled to speak with you because you've done so much training with different people who have um, expanded the understanding of Bowen since Tom Bowen. And yeah, so it's wonderful to have this discussion with you.
Thank you. Yeah. Yeah, I was introduced to it in 2013, and it was just really interesting because I was looking at what I was going to do next. My husband and I had just left Mexico as missionaries there, and so I was looking at a career and wondering what pathway I should take when I bumped into another Bowen therapist who was also a remedial massage therapist. And she just explained to me that she just noticed a lot more changes with Bowen therapy in comparison to remedial massage. Not saying anything against remedial massage or anything, but just that she saw a different level of healing with Bowen therapy. And so that is what got it started.
Mm. So what was your journey then? You took training, I believe with Botech originally.
Yes.
Mhm.
I looked online and there was a lady called Robin Wood, and I don't think she's with Botech any longer, or she's with the arm that works, I think, in Germany now. And what was interesting to me in choosing her as the instructor was that her father was treated by Tom Bowen.
Ah,
And so she was interested in Bowen therapy because she saw the result of her father having probably, I'm not sure if he tore ligaments in his elbow or he did something to his elbow and wasn't able to move. The doctors said there was no way that it could be that it could heal. And so he went to Tom Bowen. Tom Bowen worked on him a few times, and one day she noticed that he was eating his breakfast cereal normally without even realizing it, sort of just gradually healed on its own after a few sessions.
mm,
And so she was excited about it because she saw firsthand how it worked.
mhm, mhm.
So I went to her workshops, finished the certificate one with her, and then learned a lot through just her stories. She was a storyteller. And
Mm,
so it was always fascinating listening to all the different ways people had been helped. And
mm,
then as you start to learn, you start practicing on your own family and you see results right from the very beginning.
yeah.
So that's what kept um, egging me on. I continued to learn, and the more you learn, the more you understand what you don't learn, what you don't know, and then you keep learning. And
Mm,
one modality turns into another, and other therapists start talking about another type of modality. So you take that workshop, and I guess I've always had a thirst to learn
right.
because I
Yeah.
don't feel I've ever arrived. So
Yeah. Well, I think, all modalities evolve as well, with the eyes of another type of therapist that takes on that modality without changing it completely, just
Right.
more or less working with it and then adding their knowledge. And
Hmm.
then it sort of transforms and it becomes a little bit, unique to the way they're doing it. And I think that's the nature of, such a simple technique. I think compared to so many things out there, it's fairly straightforward and simple, and people are shocked at how
Hmm.
it could work given, how little you do, right? But you've worked with whom now? How many different people that have sort of done that to the technique, have taken it and then moved it onwards and added their spin and understanding?
Well, I've taken it with Ron Fallon, who's
Yep.
come to Vancouver several times. Watching him is amazing. Watching his technique of assessing the TMJ and seeing how that relates to other parts of the body. I've also gone to John Garfield's workshop. Uh, Alistair McLaughlin, his specialization is the scar tissue release. And I've taken classes also with Graham Pennington. His assessment for me changed everything. That was probably the one workshop that changed the way I did Bowen the most, probably starting from him. And then adding to that, I began to become interested in Ross Emmett's technique, which is a very light touch muscle release therapy.
Mhm.
Different than Bowen, but you
Yeah,
can work together with Bowen.
right.
In fact, Ross Emmett was a Bowen instructor. He started
Yeah,
Bowen therapy and
yeah,
developed his own technique.
exactly. I think he was one of the seven or whatever.
Yes. Well, he was one of the original
Yeah, yeah,
guys.
yeah, yeah. Interesting. And then your many years ago you did psychology, and you were saying when we talked that you're going to complete this. And I was wondering, given that you're doing Bowen, what is it, why psychology, and how does that make sense to where you're at in your practice now?
Well, I actually have just started the psychology degree. It's not something, I mean, I've taken many courses in mental health. I believe that the way we think about our health affects our healing,
Mhm.
even the belief that we will get better. You can see a person's uh, blockage when they think that they are not going to be healed. In fact, you can even see it from a from a spiritual perspective too.
Mhm.
If you look, I'm someone that reads the Bible, and one of the questions that Jesus asked someone was, "Do you want to be healed?"
Mhm.
You know, it was a sort of a challenge because sometimes our thinking is such that we actually prefer to be sick because it adds another, people might pay more attention to us if we're sick, or it adds a different dimension to our identity. So yeah, I think there's a lot of people that come into your practice that are struggling with a lot of internal um, just trauma. And it's more, I would say that taking psychology, how I would blend that in is just having more of an understanding, maybe,
Mhm.
and just probably from a professional point of view, you can also provide counsel, maybe. I mean, it could be included. I'm not sure I would do the two therapies at once. It would probably be a separate
Mhm.
visit.
Yeah. Well, it's interesting because when you mentioned that at Bowen College, what I do is I teach not psychology, but I teach how to listen to your body, which means, also observing your thoughts and
Right.
how they interfere or or not, in how you see things, or what you believe about healing, or what you believe about the name of your so-called condition or disease, so our symbolic stuff. We're very symbolic as people when we get
Mm-hmm.
back down to our roots. Um, when the way that one describes fascial pain can be um, very indicative of what is needed as far as Bowen therapy. So what I have found training, because I've trained now over about 2,500 students, I found that when they understand a person better, that's all it is that
Mm-hmm.
actually being able to listen, which gives the space for the person to share what it is. But when you have that ability, you're going to be in a very different position in helping them.
Mm-hmm.
And so I incorporate that in that way. It's more as, I guess, a simple way to call it would be bedside manners, but it's not, it's more than that. It's just
Right.
that presence, that knowing presence, and knowing that you don't know more than they do about their body.
Mm-hmm.
Right. So, but I have found that to be really helpful when people tend to think that it's just a physical therapy. Oh, it's just a physical therapy. There's nothing more to it. And it's like, nah, you know, I hate to differ, but it's not just a physical therapy. It
Mm-hmm.
helps on every level, and I find that the most fascinating part anyway. So that's been my angle, at Bowen College, is making sure that students have that holistic perspective.
Mm-hmm.
The body is the temple,
Right.
but there's a temple. So, anyway, you're moving, or you're currently in Canada, in BC, actually, right?
Right. Yeah.
And you mentioned, oh, I've started over so many times because you've had to move, or you had to move from Australia.
Right.
And then you were in Mexico. Like, so tell us a little bit what it's like to be in that position, and how do you start up again? Or what?
That's a good question. Well, first of all, right now I don't have my tables. Usually I have my massage tables, and I've got all my books, and just all the physical things that you need to give a therapy. And so because I don't have all the equipment, today actually I spoke with called someone that I think owns a treatment space, and I call in to see how much I can, the availability of renting a room, and all that marketing, and you have to start from scratch. And so because I'm also going to be studying, I'm trying to see when the best time is to start. And at first it's very overwhelming when you start in a new place, because you're thinking, how is this going to happen again? But usually what I do is I start by giving therapy. I actually give therapies for free to friends, and usually word gets around when something changes. Yeah, I usually start like that. And then after the first session, usually they're very willing to pay whatever it is that I'm charging, because the results are there.
Yeah. Yeah.
So
Yeah. Well, I've moved, I guess, with Bowen 3 times. Which that's basically what it was.
yeah,
I gave treatments, and I know when I moved to Ontario from Nova Scotia, I did it on a beach, and I just said anyone, late.
yeah,
Now I was a little more agile there, up and down with
right,
it.
right.
What would your life be like if you were pain-free? If you were one of the millions who suffer from chronic pain, The thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
Stick the feet in the sand so that, they had the right, position to be comfortable.
Right.
I mean, the results were there.
Yeah.
Like, oh, wow, how can I get this again? And it just escalated.
Yeah, it just evolves. I remember I had to do remedial massage sessions for free for sports massage. That was in Melbourne a few years ago. And as I was doing the sports massage, all the technical things, I could see that this person was not aligned. And so I asked her if I could add the Bowen therapy technique. And she told me she'd always had hip pain. And I was able to see that the problem stemmed from the TMJ. So I made a few changes there. And around 3 weeks later, I got a message from her saying the pain that she'd had for years disappeared. She was just amazed. So yeah, exactly.
Yeah. And you also took now it wasn't a Bowen course, but a course.
Neurokinetic therapy.
That's right.
Yeah.
That's about that.
Yeah, that's a really good technique to add. And I took it last year here at the Westminster massage school. And I forget who the instructor was, but it was a very interesting course because it shows when it's a process of figuring out which muscle is inhibited and inhibited and facilitated, or that's what the terms they use. Basically, is a muscle functioning, or is there tightness in another part that's not allowing it to function in the range that it should? And so what you do is you do a lot of muscle testing, and it's a technique that that you have to use muscle testing in order to see, do I activate this muscle or do I release it? And that's what you're doing through the whole process. For me, it was a little bit tricky, and it is for many people. The first course is challenging, but as you practice, and you have to practice it on others. So that's something that I've incorporated too at times, and with my limited knowledge, because I just at the very beginning, but that opened my eyes too to seeing how even the scalenes affect the psoas. So scalenes are around your neck, they're the neck muscles, and your psoas is a core muscle, and how if one's tight, your psoas, and if your psoas isn't working, there could be, not necessarily, but there could be a relationship between the two muscle groups. And so you're testing that.
Right. And does it change the way, like, in other words, there are moves that we know for scalenes or moves. So does it change the way the moves are done? Like in Chinese medicine, you might tonify or sedate, right?
Right.
So is there a concept where with Bowen you go, okay, this is the move, but I'm doing it differently in order to...
Well, I think what happens is sometimes with Bowen, I know in the past when I was first learning, you just throw every Bowen move on the person and you hope something sticks. At the beginning stages, sometimes Bowen therapists will do that. You know, but what this does is you become like extremely specific about how you're going to treat. If you're releasing the scalene and you can tell that the psoas is inactive, you're not going to release an inactive muscle. You're going to exercise it. So I'm not going to use the Bowen move on the psoas, maybe, because that's not the area that I need to release. And so it's understanding that relationship, not giving the body too much.
Right.
Because if it doesn't need to be released, you're not going to release it.
Yeah.
You release just what needs releasing. Otherwise, you
Work it.
release muscles that don't need to be released.
Yeah. Well, I mean, that's another concept in Bowen, you know, less is more, right?
Right.
More you know, the less you do.
Yeah.
Which it's kind of, you know, funny because you can be more specific then, right? But in this, it sounds like you're incorporating it with the understanding that there's some sort of exercise that could help.
Yeah.
Yeah, which is interesting because when I learned Bowen also, that was in 1992 with Ozzy and Elaine. They had exercises. They didn't make much sense to me, you know, so I didn't do those exercises. But the notion that sometimes you need to work a muscle,
strengthen it. Yeah, you
just
need to strengthen it.
Makes sense, right?
Yeah.
Yeah. So this gives you that understanding of, okay, these need strengthening, these need releasing.
Releasing, exactly.
Yeah. Which when you look at how, at least according to Graham Pennington and many of these people, they say when Tom Bowen worked on people, he used the basics as a touching guide of what was tight and what was not. You know, which again is that idea that you don't do it all.
Right. Yeah.
Yeah. Interesting. Yeah. So what were, or do you have like the one or two stories that really
stand out?
Yeah, stand out and made you go, wow, this is not something I'm going to stop.
Oh, well, that happens a lot. So, and there's also times when I can't help. There's like sometimes family members, especially very difficult to sometimes work on certain family members. The good thing is my husband's a good sport. My immediate family is fairly open and I've been able to help them, which is great. But sometimes, you know, other family members don't respond. And it's better they go with, it's actually sometimes better to let them go to someone else. It's more professional. And but anyways, this year, a friend of ours fell out of a tree and could have died, but he didn't. He's amazing. And his ribs were affected. I don't think he broke. Oh yeah, he did break a few ribs and he had continual rib pain. And so in that situation, I told him, you know, I can't guarantee that I'll be able to help, but allow me one session. Just let's see if the procedure, and I'm not quite sure what it's called because it's it's a specialized procedure that we do in Bowtech. And it is one of the quote unquote recipes where you're not assessing anything. You're just giving them a standard set of moves. Well, I applied that procedure, and I would say there's about maybe 6 to 8 moves. That's it. I mean, it might take you 5 minutes to do the move.
Sounds like I think they used to call it chest procedure or scoliosis procedure.
It was the scoliosis procedure, I think. It wasn't the chest one. Anyways, I did that on him, made him wait 15 to 20 minutes. He got up, didn't really feel any difference. I said, just wait a few days. Sure enough, a week later, his pain that he'd had since the accident completely disappeared. And he couldn't believe that he could feel so good. So he made me redo it just to be sure. I said, you don't really need it, but sure, I'll redo it. And he's been fine since, which is amazing because he could have died. He was in that bad a shape, falling 20 feet out of a tree.
But also with ribs, I mean, they can't do much with ribs.
No, they can't.
So it's a godsend. I know in homeopathy there's a few like remedies that help the body heal, but here I do think that using the fascia, also really resets it so that the body knows what to do, right? We're programmed to heal.
Right. And that's where, in that situation, I would not want to use neurokinetic therapy. Because neurokinetic therapy, you're moving, you're doing different moves, you're comparing. It's a lot of making the client do a lot of movement that could put him in pain. And so maybe, there's a chance that you might apply that technique if the regular recipe doesn't work, let's say, then maybe you start using other techniques, because that's usually what happens. But in this situation, just the regular procedure that we were taught worked, which was great. So simple. Didn't even do it. I didn't do an assessment. I mean, I did the regular assessment that I do, but I didn't do any muscle testing or anything.
Yeah. Well, I don't think it's always necessary, right? It's
no
a guide, right? It's a guide to what's going
on.
It is just a guide.
Right, exactly.
Yeah, so no. Makes sense. So so what are your plans then with Bowen?
With Bowen? Well, I'm trying to figure that out right now. My desire is to continue practicing Bowen to some capacity. So I'm looking at how I would do that, renting a room. I'm wondering, do I, there's many different ways to do Bowen. You can go to people's homes and set up your table. Do I want to do it that way? Yeah. So yeah, I'm just trying to decide, but yeah, I'll never stop doing Bowen. It's just part of me now.
Yeah.
So
because I mean, there's several naturopaths. I mean, a lot of naturopaths left BC as well during the last few years. So, but there are naturopaths that are likely looking for somebody who can do Bowen, because some of them have trained in it, haven't kept it up because they have all these other skills that they also use, and and so often it's a perfect situation to have one dedicated Bowen therapist that you
can... well, I'll be contacting naturopaths as well.
That's probably a good
usually they prefer, because they don't know, some of them don't know much about Bowen therapy, so they prefer that you have done the RMT program. I mean, that's been my experience, but that could be different now.
I think it's different
because they can't direct bill, but you know what I mean. So I haven't ventured out. It's been Christmas, and so I was kind of waiting for Christmas to end before I start knocking on doors. But yeah, my desire is to continue to practice.
Great. Okay. Well, and any other questions you have? Otherwise, I mean, it's a great sort of overall, show of what Bowen is and all the different varieties, what one might or starting a practice in a new place. I'm trying to think, is there anything else that we've missed that people might be interested in?
Well, I would just say that any opportunity you can learn some sort of body technique to add to Bowen, learn it, even if it's just to understand why Bowen works. I think it just helps understanding the body.
Yeah, definitely. Okay, well, thanks very much for spending some time having a conversation about Bowen therapy.
Oh, no problem. It's been great. Thank you, Manon.
Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.